Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Request. So, and we talked about sleep last week, but this article talks about aging and how as you age, you get aches and pains, and the remedy that they suggest more than anything else is exercise. And they talk about, especially as you reach the age of 70 and above, how the aches and pains increase. But the more you exercise, the less likely you are to have the pains and aches. They talk about some exercises that you might try that are simple. Sitting on the edge of a table, extending your right leg and keeping your body straight, and then stretching. They talk about stretching exercises. We talked about the cardiorespiratory vascular exercises, but stretching, that's something we've talked a lot about, but stretching of the hamstrings and the shoulders and the neck are all parts of ways to stop aches and pains and keep your muscles trim. And also, this helps as you age. Most of you are not in that bracket of 70 and above, but people like me and others who are exercising more than 150 minutes a week becomes almost paramount to stay in good shape. Some people wake up and they have aches and pains. Some people wake up and they're thrilled to be awake and they have sound minds and no aches and pains. So it's good to keep in mind the importance of exercise.
Okay.
Okay, John, do you want to start this?
Dr. Callender?
Yes.
One of the courses free. Every time it comes up, I take it. And this is living a healthy life with chronic condition. And so if you ever get a chance to take this class, it's very helpful. Fellow Zoom people.
Okay. Thank you very much. That's interesting that this is one of the Medal of Freedom, Presidential Medal of Freedom honorees, was the first American to get the vaccine. And it's nice to see a nurse get an award like that because they do so much anyway. Often go unheralded. So I thought this was nice that Biden does a lot of nice things that he doesn't get credit for. But anyway, I thought that was very nice and inspirational.
She was not only a nurse, but she was the first American, period.
Right. So I thought that was very nice of them to do that. Oh, it was nice to see that Denzel Washington was one of the honorees as well. And some 16 people or so. Gabriel Giffords, who actually got started the Gold Humanism Honor Society. And Steve Jobs, interesting.
Denzel didn't make it because of COVID. He tested positive for COVID.
Say
So
what?
he didn't make the ceremony.
Oh, that's too bad.
Denzel Washington tested positive COVID, so he
Good
did not
reason
make
not
the
to-
ceremony.
Good reason not to make it. Yeah, but he's richly deserving of that award. It's nice to see him to be recognized.
That's the photograph of the ceremony.
Okay, next one. It's an interesting one. It just so happens that this is a Nigerian-born doctor who lied about his age and I don't know how many of you know about bone marrow punctures, but basically most of them are done in the hip because they stopped doing them in the sternum for the same reason that this man you can go through the sternum and go into the heart, and that's what happened to this lady and killed her. But they actually, that's reason enough, but they also found he lied about his age. And so they actually sentenced him to, because of the fact that he lied about his age. I'm not sure that lying about his age has anything to do with it. When the patient tells you to stop, you have to stop. You can't just go on and proceed in spite of the. So, and many reasons why he deserves not to practice medicine again. Whether he's from Nigeria, whether he's from the United States, doesn't matter where he's from. He's a danger. But it just points out that you have people who are good in medicine, people who aren't, and so you have to do some of the things that you've heard in this group to make sure that the people that you're trusting with your health are understanding that all of the care is patient-centered. It's not physician-centered, not nurse-centered, not healthcare-centered. It's patient-centered. And when the patient says stop, you have to stop. And that's why they accused him of murder. Anyway, I think most people have stopped doing using the sternum as a site for bone marrow biopsy because of what happened with this patient. Yeah. So, anyway, I just thought I'd let you know that they're wonderful doctors, and they're doctors who aren't so wonderful. So,
Dr. Callender,
yes,
excuse me, when they do the bone marrow donations, they get those from the hip, right?
right,
Okay.
and they actually put you to sleep for that too.
That's good.
Yeah. There's an article that is of no surprise to us that the diets that fight disease, but I just thought I'd include them to foster. And these are the 6 diets that they have. We've talked about many of them. Of course, the plant-based diet, the DASH diet, and all of them. But all of them play a role in terms of having a healthy diet. Of course, a low glycemic diet means that you decrease the amount of sugar, decrease the sugar and the insulin release, which is likely to decrease the amount of arteriosclerosis and things. Emphasizing the low sugar and high in fiber. And of course, who's that eats oatmeal all the time? Is that you, John? Yeah, healthy, yeah. And then of course, this is likely to keep your hemoglobin A1C at a reasonable level, which of course is one of the keys to good health. The plant-based diet that we've talked about forever, and many, as we know about the Seventh-day Adventists and now the vegetarians and the vegans who eat no meat at all. And and these are all keys to good health. And the DASH diet, which is specifically noted to treat or prevent high blood pressure. Again, associated with reduced red meat intake and reduced sodium, and of course sugar and fats. So these are some of the diets that are recommended. And I think he nicely points out what DASH stands for. And it's, again, same things we talked about right here, meat, sodium, fats, and sugars. Then those are the gluten-free diets, less commonly discussed. But there are people who, if they take any gluten, the GI tract responds in an unfavorable fashion. And so those people have to have gluten-free diets, which are probably more expensive than other diets. Then the ketogenic diet is a diet that we don't talk much about. Low carb, high fat, which emphasizes less carbohydrates. And
I have a question,
yes,
and let's see, Dr. Atto, and I know Dr. Callender, you've spent some time in Africa, but okay, the bitter fruits, things like lemons and grapefruit, they produce natural quinine, which makes you, well, you know, quinine is one of the cures for malaria. It makes you less attractive to mosquitoes. And so my question is there part of the African diet, is there a lot of consumption of bitter fruits that may contain quinine?
what kind of fruits did you say?
Bitter fruits like grapefruit and lemons, they
Oh,
produce natural quinine in the body that makes you less attractive to mosquitoes. And, you know,
in
mosquitoes
the
carry malaria.
in the area that I was in, which was in Nigeria, Port Harcourt, Nigeria,
Oh,
that was not the case. Yeah, I was in Port Harcourt, Nigeria, which is east part of Africa, of Nigeria. Dr. Atto, you were going to make comments?
Yes, Port Harcourt. Yes, I lived in Port Harcourt during my high school days. A lot of the foods we eat, they contain a lot of. Do you know something called cola nuts? Cola nuts. Cola.
Cola. Oh, okay.
Kola. Cola nuts. It's a
Yeah.
typical nut eaten by people all over Nigeria. It has a bitter taste. And yes, people believe that it has some medicinal value, such as anti-malaria and other diseases. And in Africa, we eat a lot of fruits. That's correct. You know, lemon, guava, you know, different kinds of fruits. I don't remember their names, but I think they aid in these infections like malaria, these diseases like malaria, yes.
So that wasn't in the case where I was. They had, of course, fruits and vegetables, but not the ones that you mentioned.
Okay.
Okay, and so these are the diets that good at helping you stay healthy. And of course, it's mentioned time and time again that in terms of the developing countries, we have among the shortest length of life, in contradistinction to many of the other developed countries. This is an interesting article because we don't talk much about hearing and loss of hearing. This talks about the importance of getting audiology tests at least every other year after you reach the age of every 5 years after the age of up to the age of 64. After that, I think it's every 1 to 3 years I think most places say every other year you should get hearing tests, because they say that close to 70% of people over the age of 70 have hearing impairment that they don't recognize. And whether they recognize it or not, they don't do much about it. And then getting hearing aids and wearing them and replacing them every 5 to 7 years becomes important. As I think Darryl mentioned, he talked about how he was able to get a very cheap hearing aid in many ways. His hearing aid was better than most of the hearing aids. And you want to make any comment about that, Darryl? You talked to us about that in the past.
Yeah, Monday I had a hearing exam and a hearing aid fitting at Costco. And, the quality of the hearing aid was about equivalent to my Apple AirPods, but they were so much more comfortable. And so I'm going to be getting the hearing aids next month from Costco.
Oh, how much are they going to cost you?
Well, okay. The ones I want to get are the behind the ear hearing aids. You can get in the canal invisible hearing aids, and they're not as comfortable. And so the behind the ear hearing aids, they've got the maximum comfort and they've got the most features, such as they're Bluetooth enabled, so you can control them with an app. You can listen to music, take phone calls directly from your hearing aid. And so I like the comfort level. The ones I picked are $1,400. Little
That's
lower
kind of
price.
cheap.
Yeah, lower price at Costco. If you got them from an audiologist, more likely to be about $2,000 for behind the ear hearing aids. The invisible ones, the prices range from $3,000 to $5,000. But okay, I also like the rechargeable feature, and so I just recharge them over the night. Overnight I can get 20 hours on a charge. So it's just a matter of wearing them all day very comfortably.
Okay, and there's also been an association of those people who have hearing loss and don't do anything about it, with increased incidence of Alzheimer's, which is discussed as well. And then associated with hearing loss can be tinnitus, which I think Chris has had for several years now. And really, if any of you have ever had it, it is it's just so bothersome that I've had it for short periods of time. But imagine somebody having it for a year or so. And Chris has had it for several years now. So
He continues to have it. I think that's more annoying than the lack of hearing. And he said with the tinnitus, you have this constant ring,
right,
morning, noon, and night.
right.
In the beginning, he was trying to deal with it with soothing sounds at night, waterfalls, and that kind of thing. Nothing really helped. The lack of hearing he still has. He's been going, believe it or not, to Boston to a specialist periodically. And the main thing that they were impressed with was his hearing aid, which he got through VA. And they said that was the best out there. And they did their analysis of his hearing and the hearing aid, and they really couldn't help improve his hearing. The only suggestion they had, the setting on his hearing aid, they said it should be lowered. And they did a report and they forwarded it to VA. He still has the tinnitus, but not as bad. Initially with the tinnitus, he would literally fall. He couldn't control his balance. But after having it, for a couple of years, he deals with it. And now I don't believe it's quite as bad. He tolerates it. Around the house, oftentimes he'll take it out and lay it on a table, which we around the house have gotten used to because he can function a little without that hearing aid. But his came about suddenly. And it was really strange. It was weird, but the outcome was related to stress. But no real improvement with it.
Yeah, Ludwig von Beethoven, the very famous classical composer, had that condition toward the end of his life. His Ninth Symphony is based on the note A, which is the ringing that he heard, and he actually went deaf at the end because all he could hear was that note A. I've had some people call it tinnitus because of the double N.
Yeah, that's what we're talking about.
I've had it for quite a few years, basically due to not taking care of my hearing on stage. Very, very, very loud music. I've been to the audiologist. I have to go every year for scuba diving, but they recommended hearing aids. My spouse complains all the time about my hearing. We're the last people to know that we have hearing loss. Everybody else tells us.
Yeah, that's how you find out. Yeah.
Keep saying what?
But I think it's amazing to me that when you look at an elderly group of people, how few of them actually have hearing aids. When in point of fact, they say that greater than 70% of people who are over 80 have hearing loss.
There's another thing though. People advertise you see them on the TV. Oh, you can get these fantastic hearing aids for $200, $300, $400. Those can hurt you a lot more than they can help you.
Yeah, the comment you made about people don't realize how bad their hearing loss is, I thought mine was just slight, but my tests show I've got 50% loss in both ears. And just with the AirPods, hearing everything is kind of wonderful. It's like a brand new world.
Yeah, it's but what is amazing is that most elderly people don't get their hearing tested, so they don't realize it. And as you pointed out, others have to tell you about it because you wouldn't be aware of it. You don't know what you're missing. So,
but even after others tell you about it, they still don't believe it.
I know what you're talking about.
Well, there's a stigma associated with it.
Because when they tell you about it, you can't hear them telling you about it.
Interesting. Okay, all right. And then the last bullet there is John. Oh, airwax. Yes, of course. The only way you know about that is you get somebody look in your ears, and your otolaryngologist can take care of that. Of course, you have to take. It makes it easy if you take drops to dry up the lubricate the wax so that it makes it easy for the doctor to get it out. Otherwise, it can be very painful. And then, of course, this is the last thing that I don't know if Buchanan did this at all before, but protecting your ears from the hearing loss is something that you can do by putting earmuffs and things like that, earplugs. It's unusual to see people these days doing it, although if you have the those things that you put over your ears, some people think that they're listening to music, but sometimes they do that to protect the ears from hearing all of the noises. And as you drive, as you go down the street, you hear some people with music so loud that it deafens you, and you wonder how they're managing to escape hearing loss. But in point of fact, they aren't. So.
Yeah, there's another ear protection thing. It's called the Eustachi ear relaxer. You can buy them at CVS, and it's for people whose ears won't pop when they land on planes. When the descent.
Yeah, I have one.
Yeah, I have a big problem with that. You know, I have to go through all kind of contortions to get my ears to pop when I land. But I got a flight to DC the end of August, and I'm going to use that Eustachi ear relaxer to see if it gives me some relief.
You know, what I started doing, which seemed to help some, but I'm not sure that it helps a lot, was to actually chew gum. I found that that helped to some
Yeah,
extent.
I tried that. That didn't
I
help.
also used to use um, Afrin and other things that uh, dilate uh, nasal passages, and that helps some. But it can be painful. Uh, and I used to have a lot of pain when I flew, and one of the things that helped me was uh, chewing gum.
Yeah,
Yeah,
chewing gum doesn't work for me. I got a lot more problem than that.
yeah,
Yeah, okay.
yeah. Dr. Callender, I have as a diver, I have to equalize my ears every 5 feet or so as I dive, as I go down, and you can do very serious damage to your ear structures if you don't. Same thing happens when you fly. You have to
Yeah,
equalize the pressure.
that's right.
Um, I have a very sad story about my hearing. I was at a gig one time and it was so loud, it was painful. So I put these earplugs in, and one of them, it felt like it was coming out. I took my finger to adjust it and pushed it inside my ear canal, and I couldn't get it out. And it was impinging on my inner ear. So that was extremely painful over top of the volume that was so loud. I had to I had to rush from the gig. This is 3 o'clock in the morning to the emergency room, and the otolaryngologist had to take tweezers and go inside and pull that puppy out. I was very, very, very painful. So now I I use in-ear monitors that are custom fit. They take a mold of my inner ear and put the monitor speakers actually inside it. So not only can I control the volume that's coming in, but it also protects me from the loud volume from other musicians, like the drummer, which really caused a lot of my hearing loss. My upper frequencies are pretty bad, especially my left ear, because I was right next to the drummer for 10 years.
Well, you know, it's amazing the bodies that God's given us are, and all of your body parts work together as one. And so all of your body parts need to be taking care of, your teeth, your ears, and all of it. And so it's a warning.
Right before we leave that, when I was teaching music survey or music appreciation, they had one chapter in the book about the ears, about how the loss of hearing comes. One of the hazards of being a musician is the loss of hearing because of the noise that the sounds that we're subjected to. So we always told the kids to best protect it. And I know one time John and I went to a concert in a church, and the music was extremely loud. And we just looked at each other and got up and left, because there's no sense of subjecting yourself to loud music when you know it's going to cause you more harm than good. But a lot of things that are prevalent in churches these days, they call it praise and worship, and they pump up the volume of the sound, which is causing everyone there to lose their hearing, because you cannot gain it back. And, we went into the scientific reason of why we're losing our hearing. So that's something that all of us should be aware of. And then we pointed out that, like, even airplane traffic, they had something on their ears, even the noise that we're subjecting ourselves to, even in the hum in the house, the hum of the light bulb, that is causing us to lose our hearing. So all of us should be aware of that. When you're in any environment, and particularly musicians, you should always protect your ears, and if possibly walk away from loud music, loud sounds to protect your ears because you cannot gain it back. One time our son, this last story, he was playing and singing in his college choir in Drexel. And we went all the way up to Philadelphia, and the music was extremely loud because they were in a cathedral and the sounds were bouncing off the walls anyway with the acoustics. So John just got up and they had the amplifiers and everything, which they really didn't need, and turned it off, and all the parents started applauding because the kids couldn't hear any difference. But the parents, we're sitting out there trying to enjoy our kids singing, but the singing was much too loud. Of course, they were happy about it. Everybody was happy, but we were happy because the sound was at least lower that we could almost bear it listening to them sing.
Yeah,
Okay, just
interesting,
don't.
the importance of earplugs. Yeah.
Yeah, just don't get mad at the people running the loud sound because in a lot of cases, like in my case, I couldn't hear that it was loud.
That's
Because
true.
you're a musician.
That's
you
right.
know? Because I
Now,
went
this
the
is
other day to a party and they had it just pumping up. The music was loud and everybody dancing and it was loud. And I'm going, oh man, this is ruining my hearing. But I was hoping I wasn't going to stay too long listening to the loud music.
well, get some earplugs. Get some earplugs.
And then when you put your hands over your ears or put the earplugs in there, you're insulting the musicians like John Buchanan and Darryl.
Well,
I'm not
okay.
insulted anymore. I've seen the light.
This is an interesting article because it's on melanoma. It's an interesting skin cancer that is less common in blacks, but when it occurs in blacks, it's associated with a higher mortality because we don't appreciate it until it's too late. And these are the 4 warning signs that they talk about. They talk about you can have a lot of spots, but if there's one that stands out of all of the others, they call this the ugly duckling sign. And if you have one that looks different than the others, that's the one that really needs to be checked. With women, arms and legs, and it's interesting because melanomas occur in many places. Can be on the scalp, but they can also be on the soles of the feet and the palms of the hand. And they talk about Bob Marley here, who died from a melanoma that he thought was a bruise under the toe. And they point out here that while melanoma is about 20 times more common in whites than blacks, however, when it does affect blacks, because it's hard to pick up, we die more from it than anybody else. And they have lowered down the percentage of people who die from melanoma who are black and the percentage who die from melanoma who are white. And you can see Hispanic black population 66%, 90% non-Hispanic white populations. So that's survival rate. But they talk about the fact that it can be dark brown, it can be red, white, and blue. And if there's a change of color or an increase in color or lack of color, this can also be a sign of a melanoma. We don't hear too many cases about it because it's not that common, but when it occurs, I have a colleague of mine who actually the diagnosis was made by the barber who was doing her hair and noticed it, and she then went to the doctor and found out it was a melanoma, and she was dead within 2 years. And so it's important. And then, of course, with skin cancer prevention, of course, is using sunglasses and sunscreen, regardless of your complexion. It's important to appreciate that while white people have more of the traditional skin cancers, those cancers are much more easily treated than the melanoma, which is often fatal.
Mhm.
And the issue of sunburning, whether you're black or white, becomes and using sunscreen becomes an important way to prevent skin cancer. Any comments about that? Any of you have any experience with skin cancers? Well, it's good to know, because if you notice anything in your nails that doesn't go away, it's something. I'll see if I can get a dermatologist to come talk to us.
I've been to a dermatologist a couple times. I had some moles, and they call them tags, that come up all over your body. And he went over my whole torso looking for them and told me I didn't have anything to be concerned about. But I did have a growth on one of my thumbs that he had to use liquid nitrogen to get rid of. So I'm glad I went to him. That's for sure.
Well, it's one of the things as you get older, you get these signs of old age, that you have skin skin lumps that seem to be of no consequence, but it's important to see a dermatologist to find out whether they need to be biopsied or not. This is an interesting article, because we know that if you have any change in your face or any change in your mentation, that you need to go to the hospital right away, because they have a treatment that can treat strokes. And this medicine that they give you can actually knock out the clots or dissolve the clots. And this becomes important, because every minute that you lose brain cells. And so this new medicine that is easier to use than the old medicine becomes very important. But the most important thing is, if you have any changes in your face, or you have any changes in your mentation or slurring of speech, you should go to the hospital immediately. And they have this medication which dissolves clots, whether they cause, the only thing that it doesn't help with is if you have a hemorrhagic stroke. But if you have an ischemic stroke, which means that there's a clot that's blocking, these clots can be dissolved. And so the sooner you get to the hospital, the more brain cells that you could save. And so this new treatment, which is more easily used to treat, because the other treatment is very effective, but it takes a while to start it. And so this is just to keep in mind that should you have a change in mentation or a change in your face or anything like that, go to the hospital immediately, because this can be reversed in many instances. And I know a number of patients who came in with paralysis, but were able to get the clots dissolved, and the paralysis was resolved. So keep this in mind if you have any friends who have any kind of changes in their mentation, or their face starts twisting or anything like that. You have them go to the emergency room right away, because there's a treatment that can make a difference that is critical. Now, will exercise save your life? In my view, I think once you're over 40, exercise is mandatory. But many studies have demonstrated that often less than 20% of Americans actually are exercising. And this study kind of points out how important it is to exercise and how it reduces your mortality rate. And It's something we talk about every session, but it's not something that we can overemphasize, because taking the time to exercise allows you to age. That's one way of putting it. And this talks about those people who do all the exercises on weekends in comparison to those who do the exercise on a daily fashion. And it appears that it doesn't make much of a difference, that if you want to do your 150 to 450 minutes over the weekend or do it daily, the results seem to be the same. It's just that the weekend warriors probably are younger and they can cram it all into 1 or 2 days.
Dr. Callender, I have a question. Can you hear me all right?
Yes.
Atrophy, is that a body-wide problem?
The muscles atrophy means that the muscles or whatever you're talking about is decreases in size. And yes, wherever you have muscles, as you age, they do atrophy. And so exercise helps decrease the amount of atrophy that you have in the muscles.
And can you do exercise in association with medicine to try to reverse atrophy?
Well, and so far we've not developed that. There's an article that talked about for people who can't exercise to do it with a pill, but that has not yet been developed. So you got to do it the old-fashioned way, exercise. And you may have to be creative for those people who have comorbidities that make it difficult for them to exercise.
Dr. Callender, Dr. Callender,
Yes.
I have a question, or rather a comment. As we age, does it mean that the amount of earwax that accumulates in our ears, inner ears, builds up more? Because when I was younger, I normally don't clean my ear with a cotton swab. But when I turned around 65 or so, and up till now, I noticed that after I bath every day or so, I have a feeling of cleaning my ears with a cotton swab. Is that a good thing? I wonder. And then when I clean it, especially my inner ears, I bring out a lot of earwax.
Well, I think you need to. That's an interesting observation, and I'm not sure whether or not that's the case. But I do know that you need to have your ears examined by an ear doctor every 5 years until you reach the age of 65. After that, you need it every other year. So you need somebody to look into your ear and see if it's wax or not. So you're doing it yourself, I don't think is adequate.
When I go to my regular yearly medical checkup, they look at my ears. The guy, it's not a medical doctor, but I don't know what they call them. It's a registered nurse.
Nurse practitioner?
Nurse practitioner, yes. He checks my ear with all those instruments, and he says my ears are okay.
Well, if you don't have wax, then but wax is easy to diagnose. So if you look in the ears, you see it or you don't see it.
Okay. Okay, thank you.
This is an article on something that we don't talk about, the internal clock or the cycle of life, circadian rhythm. And they call it the master pacemaker, and it's located in the hypothalamus. And it's thought, it's interesting, as I think Darryl had mentioned, that most heart attacks and strokes occur early in the morning. And it's a mystery as to why that happens. And this clock that we have, circadian rhythm, is important because it also controls the leptin, which is the hormone that controls the appetite, which Darryl has mentioned before. And that appetite is a menace to society in many ways because it may be the reason why people overeat. But this circadian rhythm is why when you go from one place to another, we go from United States to Australia or to Japan or China, your time clock gets changed around and you just feel bad. And that's why melatonin is helpful in regulating sleep when you come back from places like that, or you go to places like that. But the circadian rhythm is the process that determines how your metabolism goes. And the leptin is the hormone that is produced that affects that. And we don't know as much about it as we would like to know. Well, we do know that physical exercise is related to the circadian rhythm. And the question of when you should exercise has been a source of much discussion, but I think it's clear that you should exercise when it's convenient for you to do so, although most people think in the morning is more likely because it fits the normal metabolism process. But anyway, there's the circadian rhythm, which has a lot to do with your health. Any comments about that? Because this is something about your biological clock that has to do with whether you live or die, whether you have a heart attack or not. And, so there's a lot of discussion about this and what we can do to impact the circadian rhythm and keep it in focus so that you sleep when you're supposed to sleep and are up when you're supposed to be up.
Yeah, I've got something that's a little anecdotal. Being a musician, I've got a lot of late nights where, I try to get 8 hours sleep. That'll take me into the morning the next day. But for a long time, I tried to use sleep masks to sleep, when it was light outside. But I found that I get more restful sleep when I don't use a sleep mask, so I don't use them anymore.
Interesting. And because you're doing what's more natural, I guess. So, and this is kind of talking about getting along with your biological clock, and the field of chronobiology is a interesting area that we don't know as much as we should about. This is something that we've talked about ad nauseum, but adding salt to your food is linked to high risk of premature death, which is not a surprise to anyone, especially for people of color who respond more adversely to salt than many other ethnic groups.
Salt really tastes good, and I'm sure I can get an amen on that. But when you're trying to avoid salt, you could use lemon to make it tasty without salt.
Good to know. Good to know. Because salt is harmful, as you see here and as we've seen everywhere, particularly as it relates to our ethnic group.
Is there anybody that can eat French fries without salt?
Huh?
Say again?
Anybody can eat French fries without salt.
I can.
Well, you know, the one thing that McDonald's has been good about is not using so much salt in the French fries. Used to be horrible. I mean, oh, great, whatever way you look at it. But they've decreased the amount of salt in French fries. But they're still good enough to raise your blood pressure.
Joyce, how did you do that?
Well, over the years, I have reduced my sodium intake. And when I don't need sodium, I don't add sodium to my foods. Like when I eat my oatmeal, I don't add sodium. When I eat my grits, I don't add sodium. When I cook eggs, I don't add sodium. My sodium intake, I've tried to control over the years, and I've gotten to the point now, if I want some French fries, when I go to Burger King, I ask them to give me French fries without sodium, without the salt. And it's fine with me.
Yeah, I got a comment about lemon. Lemons that you use at home are great. Restaurant lemons are basically nasty. They cut them up, put them in a bowl, breathe on them, sneeze on them. They're some of the
Right.
most germy things that you could possibly eat in a restaurant. So if you ask for your water with some lemon in it, that's like give me a water with and make it as nasty as you can.
Well, there are many studies that have authenticated what you're talking about, and they say that getting lemons the way that it's done is germy, as you said.
But it wards off mosquitoes.
I hadn't heard that one before. Now, this is an article that is not a surprise to us, but is something that is important for others to know about. And that is that pulse oximeter, and because of COVID, many have used pulse oximeters. Didn't recognize the fact that it's based upon the color of your skin. And those who have dark skins, the ultraviolet light that goes through it allows for inaccuracies, and as a consequence, pulse oximeter readings may not be as accurate. And for that reason, this study has documented that people of color are less likely to get an adequate amount of oxygen because the pulse oximeter doesn't read adequately because of the complexion of our skins. So this means that if you're in an ICU and they're doing the pulse oximeter on you, that you need to make sure that they're aware of the fact that pulse oximeters sometimes are inaccurate people who are darker skinned than others. And also can be impacted by obesity if you're very heavy. Now it's interesting because of the pandemic, you see the increase in the amount of money that companies have made from the pulse oximeter. Because with COVID, that's the one change that takes you to the hospital if your pulse oximeter is less than 95.
So, Dr. Callender, does that mean when we use a pulse oximeter, the registered oxygen content is going to be lower?
Maybe, depends upon your complexion and other factors. But if you have a pulse oximeter that's above 95%, it's not an issue. But if it's less than 95%, then it becomes an issue. But this is something that we've been aware of in the African American community of physicians, but most other ethnic groups have not been aware of it. This is an interesting article that talks about because you're coughing and you don't have COVID doesn't mean that you shouldn't respect others and wear a mask or protect whatever infection you have, whether it's COVID or not. And they point out that there are people who don't wear masks who cough and cough and cough and don't protect others from them. And they think that that's not, they call it rude. The other things you might call it, it's probably not healthy to do that. And we've gotten to the point where somebody's COVID negative, we think some may think, I don't know, I'm not one of them, that coughing is less of an issue. But it's just different types of germs that they're sharing. May not be viruses, it may be bacteria or fungi or other things. So they emphasize that if you're sick, you should stay home. And if you're coughing a lot, you probably should wear a mask and protect others from yourself. How many of you have used your sick leave? It was interesting because many who work have paid sick leave. And if you don't use it, you can store it up, and when you get ready to leave, you get money for it.
Kind of.
Any comments about that?
When I retired, that was very, very helpful to me because I didn't use very much sick leave during my working years. But when I retired, that really added up, and it came out to be a very good summer when I retired. So that's a very good habit to have, especially if you're thinking about retiring.
Exactly. I experienced that too. When Dr. Callender said that, Callender, we don't work, we don't have leave. But years ago, yes, I didn't take off as much, and you get paid for that sick leave. So it's helpful.
In later years, the post office used to discourage you from keeping that much sick leave. Because for that very reason, because when you retired, you would get paid for it. So they would kind of make it hard for you would have to bring in a sick certificate every month or less, I think. They just kind of made it hard for you. But I never had that problem because I used my sick leave.
In the federal government, my sick leave went towards my years of service. So it increased my years of service, which would increase the amount of annuity in terms of the years of service that I would get paid for.
Yeah, that's kind of.
But that's under the old civil service program. I'm not sure what they do with FERS.
That's what I'm talking about, the old civil service. And I think that's what the post office wanted us to do too, was just not use it, but add it on, but it doesn't add on as much as you would get if you were to use it. So that's why I think they discourage you using it. But some people used it, some people just added it on. My sister found a way to use hers. My husband just added his to his retirement. And I used mine as I went. So
that's one of the reasons why the federal government is so into phasing out the old retirement system.
Yes.
That was one of the reasons why.
The reasons, that's true. That's true.
This is an article that talks about the number of lives that were saved because of the COVID-19 vaccine, according to that study. They say 19.8 million lives in the first year were saved as a consequence of it. Actually, what it doesn't point out is the global paucity of vaccines available to developing countries. and the negative aspect of what has happened as a consequence of that. In other words, those countries who are rich have the vaccine. Those companies who are not rich didn't have the vaccine until much later. And so one interesting question that you might ask is, how many of those people died that could have been saved if they had the vaccine, which is not something that people would ask, but it's something that we as a group might wonder about as we recognize the global inequities of resources, and especially vaccines, and especially the COVID vaccine. Because if it saved 19.8 million lives in the developed countries, how many did we lose in the undeveloped countries that didn't have access to the vaccine? It's a question that is not answered, but is food for thought as we talk about global inequities. Throughout the world. Now this is a sobering article on the revenue of Pfizer as a consequence of the pandemic, which you see here that it was 81.3 billion 2021 compared to 40 billion in 2020. And the big reason is because of the Pfizer vaccine. And in addition, to add to that is the next medicine that you treat when you get COVID is Paxlovid, which is made by Pfizer as well. So that this is one company that has reached a tremendous benefit as a consequence of producing something that is of great value to the world. What is included in here is that there's a segment of the vaccine that is given to poor countries. The only comment I would have is that that's towards the end of the situation rather than at the beginning. But I guess it's a fact of life. So, but anyway, it's clear that Pfizer has been the big winner of all of this. And of course, there's a criticism of Pfizer because they say because of this, they're being a bully and trying to do things prior to FDA approval. So, but there's a lot of discussion and controversy about it. But the bottom line is that they've doubled their revenue as a consequence of their success in this field with the vaccine and, of course, Paxlovid. Any comment about this? Maybe, who cares? I mean, they're doing a lot of good, so that's good.
Yes.
Okay, next article. Oh, this is something that all of us have to be concerned about, is that the new variant is more contagious and perhaps more virulent than the previous variants. And so reinfection is becoming more common, and the amount of hospitalizations is not increased, and the mortality so far is not, but there are almost 100,000 more cases per day, they say, than before. And they are saying that the vaccines aren't as helpful. But that, of course, remains to be seen as we watch the hospitalizations and mortality rates as they occur. But I've encountered more fully vaccinated patients who have come down with the virus recently. None of them that I know of had required hospitalization, though, which is, of course, what the vaccine is for, to prevent hospitalizations and death. But it kind of makes it clear that come September, we're probably going to need to have another booster. But time will tell. But it's interesting that the variants keep coming, as has been said. And usually the South Africa and Europe get it first, and we get it after that.
Yeah, I get a subscription to MD Edge, which says that the lower your BMI, the more effective and longer lasting the vaccines are.
Makes sense. Yeah.
Less body to cover.
Yeah, that's not good news to those people who are heavy.
Yeah.
But it's a fact that the older you are, the more obese you are, the more likely you are to be hospitalized or die from coronavirus. Okay, next one, please. And I think that it reminds us that continue to wear your mask where it's appropriate, because because people are not wearing the mask doesn't mean they're not going to get COVID. So we need to do that. And this article reinforces the fact that this new variant is dangerous and evades neutralizing antibodies. People who've been previously vaccinated.
I hear y'all.
So I think we need to maintain our vigilance. Right. Okay, let's go to the next one. This is something frightening, that you have this amoeba in some beaches and some places that going through the nasal cavity go right to the brain and cause meningoencephalitis, which may be fatal. And this report points out that there's been about 6 deaths or so that have occurred directly related to this amoeba that's found in warm freshwater lakes and rivers, which people jump into without thinking twice. And this is just something to be aware of as you have your grandchildren, others who go into places that are not chlorinated, because chlorine will kill this. But if the places are not chlorinated, and some of these lakes are, then you get these brain-eating amoeba infections. And these splash pads that you talk about are non-chlorinated for the most part. So where there's not chlorination, the risk of this infection is possible. This using nose clips is interesting. You know anybody who uses nose clips?
No.
But anyway, that's one of the things that they recommend. Okay. Next
Dr.
on.
Callender, has any fish, the freshwater fish, have any of those fish been contaminated with this that you're talking about now?
Not that I know of. So far, no reports have come in from fish. It's only from those people who've gone in the water and inhaled it through the nose, and but none reported in fish issues. So, any other comments? Well, thank you. Yes.
It's funny, when I was a small girl, I learned how to swim in a lake at summer camps. And they didn't have any pools, they were all lakes. And so it's strange to hear about this, what do you call it, amoeba?
Yeah.
And get into your nose and in your brain. Yeah. You know, I guess water was less contaminated and, you know, in my younger days, but I learned how to swim at Camp Goodwill, it was called.
Yeah, I had a question. What would be the treatment for that? Or how would
I
that
don't know
even-
what the treatment. Most of amoebas are susceptible to antibiotics. So exactly which, they'd have to do sensitivity tests to find out which antibiotic would be best for it. But it's a bacteria, so an antibacterial agent would be treatment of choice. Once you made the diagnosis, of course. Okay, well, thanks for your attendance, and we'll see you again next week.
Okay, doctor.
Yeah,
Thank
Thank
you.
you.
Okay,
Thank you.
thank you very much.
Yeah.
Thank you. Thank you. Thank you so much.
All right.
It's Darryl again.
Darryl.
Daryl, you're a
Always
high
good to
techie.
end the program with a bang.
Yeah.
Yeah, yeah, yeah.
Everyone have a great day and be safe.
Yes.
All righty, thank you.
Bye.
Bye-bye.
You
Bye-bye.
too.
Bye-bye.
Bye-bye.
John, I'm gonna call you.
Happy birthday, by the way.
Thank you, thank you.
Oh, happy birthday. We have a birthday person.
Yeah, Monday.
Betty,
last
it's your
Monday.
birthday.
Yeah,
Happy
it was Monday.
Oh.
Oh, then happy belated birthday.
That's okay.
Yeah.
Happy belated birthday.
It's nice to be recognized, whether before, during, or after.
Yes, it is.
All right.
But I gotta call you, John, about some church
Okay.
stuff.
Okay, all right. Call
All
me.
right.
All right.
I like cancer people because they're the sweetest people I know, except for when you make them mad.
That's the truth.
Hello.
100% true.
All right.
Hello.
Y'all take care.
Okay, see you next week.
Wrong
Bye.
number, sorry.